Will your birth control cause infertility? This is one of the most commonly asked questions on the Fertility Answers app. It's a common myth. Here to join me for today's important conversation is Dr. Serena H. Chen. It always takes Instagram Live just a bit of time to connect the two. But does your birth control cause infertility? I see a super common question asked all the time on the app, in particular about implants. And does an actual birth control implant cause infertility? People often wonder if it is something that leads to prolonged loss of ovulation even when they go off the birth control. Some people wonder if all the years and years and years of preventing pregnancy is the result that they're having trouble conceiving now. So as we get connected with Dr. Serena Chen, we're going to cover all your questions and all the questions that we already see on the app. We love this topic because it really is one of those kind of spread like wildfire bits of misinformation out there that we want to put an end to. Hello, Dr. Chen. Are you live yet? We're still kind of waiting on that connection. We love this topic. How often do you see this as a myth in your practice about the concern that birth control is the cause of infertility?
I see it every day. So it is really, really common, because it makes sense, because we're trying birth control's primary purpose. It was primarily invented in the first place to try to protect people from pregnancy. But the truth is that there's so many non-contraceptive health benefits of the birth control pill that as fertility specialists, we end up using the birth control pill a lot in infertility patients, and it can really be helpful to them in many ways. And there have been a lot of studies about fertility after taking the birth control pills. And we do see, like, it compared to, say, the condoms, another very common form of birth control, that if you stop condoms, I have to make sure everybody sees my cuterus.
That's adorable.
Instagram.
Yeah. Oh yeah, look at that. You're cute. Yeah. I love it.
So we have to. So we do see that for the first 6 months after stopping the birth control pill, that the pregnancy rate is lower in those women than the women who stop using condoms. So let's say everybody has kind of a low pregnancy rate if they're using condoms really well or using the birth control pill really well.
Okay.
The pregnancy rate's not zero because both of them have a failure rate, right?
Okay.
Depending upon how well you take it. Even if you take it well, there's still a small failure rate.
Oh yeah, I have a friend whose son is a failure. Yeah. A happy one, a happy, thrilling failure of birth control pill. She was happily married, but yes, and definitely.
Yeah. So they have this pregnancy rate that's like this, and then when people stop using condoms, the pregnancy rate quickly goes to normal immediately.
Okay.
And but the birth control pill, when you stop the birth control pill, some people become fertile right away, but a lot of people might have irregular periods for up to 6 months. Now, if you have irregular periods for longer than 6 months after stopping the birth control pill, you really need to see your gynecologist to find out why your periods are irregular. If you had irregular periods before starting on the pill, and a lot of people are on the pill because they were irregular.
Right.
That's, one of the most common reasons for going on the pill is because you have irregular periods. If you were irregular before the pills, you shouldn't wait 6 months to try to get pregnant and then go see the doctor.
Great point.
Right away.
Great point. And we say that over and over again, and I feel like it's going to take us years for the message to really sink in. If you already know that you have a reproductive issue, challenge, problem, we want you to get into a fertility specialist as soon as possible. We don't want you to just wait and see, because the sooner that you get in to optimize what's going on, the better. And remember, these specialists have specialty training. So they've seen almost everything. They've treated almost everything. And the most important thing to folks like Serena and I and the Fertility Answers professional community is that you get in for that consult. So many times I hear people say, well, I don't want to go in for the consult because I can't afford treatment. But how do you know that you need treatment until you get in for the consult?
You really don't. And what we do have studies showing that an enormous number of people are helped to get pregnant through advice alone.
Which is amazing.
Just getting healthier, doing the right thing in terms of trying to get pregnant. Sometimes all you need is some good advice, some good testing. Like what if you have a thyroid issue? You know, thyroid issues impact 1 out of every 3 women. So, you know, I'm looking at the live right now, like we have like, I don't know what our total number is, but at this minute we have 15 people on. The second, 5 of you potentially have thyroid problems, you know, so
which is amazing.
It's crazy.
I'm one of them. Yeah,
exactly. 1 out of 3 people, thyroid issues. So, and thyroid is so easy to detect and correct, and maybe that's all you need in order to get pregnant, for us to just normalize your health condition. So I know like everybody is afraid of treatment, and honestly,
or afraid of being sold treatment. I think there's more that misconception that people are afraid to get into a fertility specialist because they think the only option for them once they're there is to get IVF. Okay. That's
if you feel like you're being sold or pushed to do something, you need to get another opinion. You need to find and call MedAnswers, reach out to them, message them on the app, and just say, you know, I feel like my doctor's pushing me too much. What should I do?
Right.
And, you know, number one, you should push back and just say, you know, I'm not ready for that yet. Can we do something else? Because you're making me uncomfortable.
Yes.
And if your doctor is if you still feel like you're in a tug of war with your doctor, maybe they're just not the right fit for you. You know, there's a lot of great doctors out there, but we're still human beings. And maybe you just need to find somebody who's like just a better fit for you.
That's right. So Emily Scream, you bring up such a great point. She knows she has PCOS. The assumption is that there's no cure and the treatment is so costly, but there's an assumption that IVF is the only treatment. These are the kind of, you know, things that we're trying to break through, is that we don't know what route you should take. We know that we have lots of content. We've had great conversations with Serena and with Dr. Raquel and other doctors.
Much great content on PCOS, and so much of it showing how we can improve your fertility without IVF.
Without IVF, exactly. But it really needs to be managed through a specialist like Dr. Chen. And, you know, we specialize in connecting people for free consults all over the world. There's another common misperception that people can't afford treatment. And you guys might not want to hear this, Serena, because there's so many people from Manhattan that are going to Barbados, because Barbados has allowed Americans a 12-month visa to work remotely. And who doesn't want to go to Barbados right now to get away from COVID? There's no COVID in Barbados. I know, you should go and you should start cycling people there. You should run all the consults and then let everybody else do all the egg retrievals. So I think that, you know, there are options, but the fact of the matter is that if cost is a barrier, then we have solutions. We can do 100% financing at Fertility Answers, even for medical tourism cycles like this Barbados option. And, you know, there is something to be said for going through it when you're not as stressed, when you're not living in a COVID, you know, lockdown environment, and, you know, you're in the lap of luxury. Do one egg retrieval and you get a couple FETs.
Doesn't MedAnswers need some help in Barbados?
We do. Exactly. We do. and you need somebody to escort you to Barbados.
I do. I do.
There's only a 7-day quarantine, and so you get to like go outside in the pool during quarantine, and I
could handle that.
Right?
Yeah.
Right. Exactly. So another user, and Sydney, make sure you ask your question. I know that at the top of the show, you mentioned that you had a question. So we have somebody else, Lauren, with unexplained infertility, which I know is one of the most frustrating diagnoses. The topic of today's, show is, or episode, my son is so funny because he watches so much YouTube and he says, "These aren't shows, Mama. What you do is an episode." And it's like, oh, sorry, I didn't know that I wasn't up on the social media vernacular of live television. So the topic is, does birth control cause infertility? And I before we even get to like unexplained infertility and how we can use assisted reproduction, but not necessarily IVF to help optimize, let's go through kind of each type of birth control, make sure we really debunk this, especially for the new folks that are joining.
So birth control actually, like I saw somebody, you mentioned somebody earlier said they have PCOS. Birth control pills actually, the minute you stop birth control pills is kind of your most fertile time when you have PCOS, because you stop the birth control pill. Often somebody with PCOS who normally does not release eggs will pop off an egg. And so
that's amazing.
That's a good time to try to get pregnant if you have PCOS. I saw somebody else had premature ovarian failure, ovarian insufficiency. Sometimes the birth control pill can lower your FSH enough that you will regenerate your ovarian FSH receptors. You stop the birth control pill, and now your ovaries, for whatever reason, just decide they're going to respond to the FSH that your brain makes, and you pop off an egg. Now, it is
fascinating.
not an accepted treatment for premature ovarian insufficiency, but for fertility for premature ovarian insufficiency or diminished ovarian reserve. But sometimes we can see that happen. That's a time where we feel like maybe you might be a little bit more a little bit more fertile than normal. So that's an interesting phenomenon. Now, ovarian insufficiency can really benefit from birth control pills because it can lower your risk for ovarian cancer and endometrial cancer with ovarian insufficiency and polycystic ovarian syndrome. Because you don't ovulate really regularly and your estrogen progesterone balance is off, you're a little bit more prone to cancer of the lining of the uterus or endometrial cancer. And for whatever reason, you are a little bit more prone to ovarian cancer for reasons we don't understand quite as well. But birth control pills dramatically decrease the risk for both those cancers, like significantly. So much so that even some BRCA patients, some GYN oncologists are using birth control pills to mitigate the risk of ovarian cancer in their patients that have BRCA and don't want to have their ovaries removed yet.
Very interesting.
Very interesting. So the other thing is that birth control pills can actually protect your fertility when you have endometriosis. Endometriosis patients, every time you have a period, you're kind of putting yourself at risk for progression of your endometriosis, because endometriosis are those little implants, endometrial tissue that normally is inside the uterus and is shed out the vagina every time you have a period. Well, you grow it all over your pelvis, and you can imagine every time you have a period, you're also having a little bit of bleeding, like a period, inside your abdomen. And that is not supposed to happen. That's abnormal. That causes inflammation, scarring. Eventually, if that happens enough, if you have severe endometriosis, you could end up needing a hysterectomy from severe endometriosis. Birth control pill use in people with endometriosis dramatically decreases the risk of needing surgery. And so my endometriosis patients, we try to help them get pregnant as quickly as possible so we can minimize the number of periods they're exposed to. Then between babies, we put them on continuous birth control pills so they never have a period between babies, and we can dramatically reduce their risk for needing a hysterectomy. We can dramatically reduce the progression of endometriosis, so we're actually preserving fertility.
Amazing.
For those patients. So birth control pills actually have the opposite effect in a lot of people. So, and if you look at the number of people that have infertility after stopping the birth control pills, the prevalence is 15%. Well, what's the prevalence of infertility on people who don't ever take birth control pills? It's 15%. Birth control pills
Gotcha.
do not increase the risk for infertility.
Now, what about Depo? Because we see on the app a lot, people go off Depo 6 months, 12 months later, they still haven't gotten a period back.
Depo is different. Depo is different. It's very different from birth control pills. It's a much higher dose of and it's a depot form. And honestly, we don't understand Depo quite as well. And there do seem to be some people who after Depo really have trouble coming back from Depo. So Depo supposedly is just like the birth control pills. You're not, it should be temporary. It should be once the effects wear off, you should be able to just jump right back in the ring. But I feel like I have seen some people that it's possible there might be some more of an impact of Depo upon the hypothalamic pituitary axis than we see with birth control pills. So
got it. Okay, so it's different.
The other thing is Depo is a long-acting form of Provera. Provera is a very interesting progesterone. It has 21 carbons, just like natural progesterone, but there's like a synthetic moiety on it that for some reason makes it a little bit different. And I'm not
sure any of us know what synthetic moiety means.
It's like an extra molecule that's
gotcha. Okay, all right.
It still binds to the progesterone receptor, but it's changed in a certain way.
Okay.
And then the progesterone in birth control pills only are based upon a 19 carbon molecule. And
got it.
So you would think that the birth control pills would have less side effects. The progesterone in the birth control pills would have more side effects than the Provera. But I have to say, as a clinician, and I don't know if I've seen any real data on this, but I've been doing this for 30 years. I get so many more complaints with Provera. People just feel miserable on Provera.
Right.
They get depressed on Provera. They feel yucky. They feel bloated. I get so many complaints on Provera, whereas the birth control pills or just the progestin part of the birth control pills, I feel like I get a lot less complaints. And each of these molecules, they're all supposed to be the same, but honestly, on an individual level, they can be very different. So just because you were miserable on this particular hormone, you could be a totally different person on another form of the hormone.
Gotcha.
So you should
that makes sense.
write off the whole class of drugs, because these drugs can often really, really be helpful to your fertility journey. And sometimes it just takes a little bit of research and maybe some trial and error to figure out what really works for you.
All right, so we've got some great questions coming in too. So let me pause there. We have, HRT. So can you get pregnant on HRT? This is something.
HRT is a very general term, but in general, HRT, hormone replacement therapy, could mean everything from birth control pills to menopausal estrogen replacement. In general, HRT is often colloquial, in just lay language, often used to describe low dose, more menopausal doses of hormones rather than birth control pills or higher dose contraceptive levels. So you can get pregnant on low dose hormones.
Okay.
And honestly, we talked about earlier how, you could accidentally get pregnant on birth control pills, because all birth control pills still have a failure rate, but the pregnancy rate on birth control pills is, if you take it appropriately, is supposed to be less than 2%.
So Natalie happens to be on HRT to get periods as well. So it is being used to try to stimulate a period. Would you recommend a second opinion or considering something else to help the onset of ovulation, like adding letrozole or Clomid or an ovulation inducer?
Super individual situation. And so that definitely requires like a one-on-one conversation
So I recommended a second opinion consult, which lots of people will do from a telehealth perspective. You know, we always want to encourage that as well, as you can request second opinion consults through us as well. Some people will even do those for free, but we just want to make sure that everybody understands that folks like Serena are available for telehealth consults, either first or second opinion. That's a perfect example, you know, that if they're using HRT to try to get her period to start, then that means she's probably not ovulating. And if the goal is a pregnancy rather than just shedding her, you know, a monthly lining, then there's some other things for her to be talking to her doctor about.
Yeah, and that's the difference between the gynecologist and the reproductive specialist. Is the gynecologist often has very, very limited amount of time to spend with you, and often they're just going to be like, let me protect your bones. Let me do the emergent thing, even though, you know, you might not just want to talk about your bones, but you want to talk about getting pregnant. The pregnancy conversation often is a longer conversation. And unfortunately, the way our healthcare system is set up, most OBGYNs don't have a ton of time to address that with you. So I do feel like it would be great if you can see a specialist. If you, for whatever reason, cannot see a specialist, you might have to do multiple visits with your GYN to address each aspect of what's going on with you.
That's right. That's right. Cece, how can you tell when you are pregnant? You gotta measure your pregnancy hormone. You can either do that in urine or through a blood draw. And so that's really important. I would start with a home pregnancy test. I think if the home pregnancy test is negative and you still feel like something's going on, then you need a blood pregnancy test with the doctor. So you can get that beta HCG level. And then let's see, Na has a tilted uterus. Does that affect fertility? Doesn't everybody have a tilted uterus? Everybody is everybody is tilted. Yes, the uterus, you know, everybody draws, like, here's my uterus picture. Everybody draws the uterus like this. And it's not like this. It's usually not like tilted. Right. I mean, because it's tilted. I should have more pictures here. I don't have any good tilted uterus pictures. So it is usually tilted. Usually it's tilted. Every uterus is tilted. Most uteruses are, when your gynecologist tells you your uterus is tilted, usually it's tilted like backwards instead of forwards, and maybe it's more tilted than typical. And that can still be totally normal. Some people with serious tilting and infertility, it's not the tilting that causes the infertility, but it might be a sign that you have endometriosis, because endometriosis patients often will have their uterus folded backwards from scarring at the back of the uterus. That's the most common. Kind of like pulls it? Does it like sort of pull it down? It pulls it down. Yeah. Okay, that makes sense. She actually already had a previous surgery as well to remove a PCOS cyst, so that must have been a sizable cyst, because normally you leave them alone, right? Yeah, it's ovarian surgery could definitely cause tilting of the uterus, because sometimes the ovary gets stuck to the uterus and everything gets stuck together. So that can definitely cause that tilting. Okay, let's see. Now, Na was on the pill from 16 years old until 23. That's pretty normal, you know, for so many of us, right? A lot of people do that, yeah. Yeah, a lot of us, you know, do that. And then she tried IUI, Clomid, and Letrozole. Nothing feels like it's working. I don't know how many. Can you tell us now a little bit, like how many cycles? After 3 cycles, usually, you know, if you're under 35 and you have PCOS, we would go up to 6 cycles of Clomid IUI or Letrozole IUI if the sperm is normal. But if you are over 35 or you have regular cycles, then we really don't want to do more than 3 cycles of Clomid or Letrozole and IUI, because the pregnancy rate, the boost you get from that treatment is lost after 3 cycles. So if you're going to get pregnant from Letrozole IUI or Clomid IUI, it usually happens within the first 3 cycles. After that, that's why we recommend really thinking about in vitro fertilization, because the effect, the beneficial effect of the Clomid IUI or the Letrozole IUI has worn off by then. And just remember, not if IVF feels like it's out of reach, we have financing options available through Fertility Answers. We also have medical tourism. We started off the top of this episode talking about Barbados IVF, and they have a wonderful medical tourism program for Americans right now, where it's only a 7-day quarantine, and it's a 7-day quarantine on a beautiful island in the Caribbean. I'm sold, okay.
Sign me up right now.
My entire remote team is like looking at condos already to see if they can take their whole family to do remote education and remote working.
The whole family, everybody.
The whole family, everybody's going together. I mean, everybody's stress level can go down together too. So it's, I want you to really, be in touch with us. Always, direct message me or, be in touch because we do have something for everyone. We do also have a virtual provider who specializes in Clomid and letrozole. So he can also take a look at your case for a very affordable second opinion consult rate as well. That's called Fertility Cloud.
I see somebody here who's been on the pill for 10 years and the OPK is positive. So you are ovulating. Your period's only 2 days. That's okay. That can be totally normal. People do obsess about the period only being a couple days long. And I don't really worry about that. For some reason, we don't see an association between not bleeding that much and
ovulation. Interesting.
Too
okay.
much, like bleeding more than 7 days and super, super heavy, that can be a problem because you could have fibroids or polyps or something else going on. So you need to be checked out for that. But it's not like a light period actually is a blessing. It's not a bad thing. And then, somebody saying they have irregular periods from 23 to 29 days, the 25 to 35 days is actually totally normal. So I'm not so worried. I don't feel like you're super irregular. The 23-day cycles, if you have those on a regular basis, 23, 24, that's kind of short. That's kind of a short interval from day 1 to day 1.
Got it. Okay. And then somebody else who was on birth control, different forms from 13 to 19, the pill shot, NuvaRing, etc. When she stopped, she started getting cysts in her Bartholin's gland on the right side. I don't know what Bartholin's gland is, so thank you for educating me. So what's Bartholin gland?
That's a gland right in by the vulva. So it actually can cause a swelling of the vulva and can be really uncomfortable and painful.
No kidding. That sounds uncomfortable and painful.
A small cyst that is not bothering you should not be a fertility issue. So if it doesn't bother you for sex, you don't really notice it, it doesn't cause any pain or discomfort, it can just be like a normal little finding. But sometimes it can get big and swollen and be like just literally painful.
Okay, got it. Yeah. All right. And then likewise, let's see, diagnosed at 23 with infertility, doesn't ovulate naturally, and the ovarian cyst, now been through IUI, now she's on to IVF. So worried about doing birth control for IVF.
Actually,
probably
if you have irregular periods and PCOS, you actually do a little bit better with a little bit of birth control pills before your actual IVF cycle. Because often people with irregular periods and PCOS, their AMH is very high and they're at increased risk for hyperstimulation for IVF. And the birth control pills can beforehand,
right,
for 2
like
to 4
normalize
weeks,
that,
can often kind of normalize your response. So it can actually make IVF go a little bit more smoothly, even though it seems like, why am I taking a birth control pill? I'm trying to get pregnant, but it can make you go more smoothly. In addition, a lot of centers like our center, we have to socially distance people in the OR. So we can't do double the number of cases we normally do during the time of COVID, and the birth control pills can help us make sure people are spaced out.
Right.
And we're following the governor's orders. This is obviously different in every state, but in New Jersey, we have to follow governor's orders about spacing our patients out safely. So.
That makes sense. And probably her worry is coming from aggravating that area that tends to develop a cyst, but probably being on Clomid would lead more to that just because of the sort of increase of the hormones rather than, as you're saying, the birth control kind of gives you like a good, baseline to start with. Got it. Okay, great. So let's see. We got some more questions coming in, then we got to wrap up. So how long after trying for a second child should I contact my doctor to getting checked up? She's 32.
I think if everything went really, really well with your delivery, like it was totally uncomplicated, the pregnancy was totally uncomplicated, you're super healthy, you got pregnant very quickly before, and nothing has changed, you guys are both super healthy, and you're only 32, then you should have a normal GYN checkup and then maybe see a specialist if it takes more than if it takes 12 months of unprotected intercourse to get pregnant. I think if you're concerned, I never feel like it's too early to see a fertility specialist, because
I agree.
even if you
100%.
haven't tried to get pregnant, there's so many things we can do, so much information we can give you to help you be healthier. And
It's
that
just
helps
worth
you have
it.
a healthier baby.
Yeah, it's just absolutely worth it. And Laura,
the only reason we don't do that on a regular basis now is because there's not enough time in the day, there's not enough doctors, and most insurance companies they're not really into like this proactive preconception health,
which is super frustrating. That's our
very
whole
frustrating.
mission,
But
and it's our whole mission is to get you in.
Do it, I think go for it. Go.
Yes, exactly.
More power to you.
Laura is looking to start IVF, looking for someone to talk to, guidance that is not costly. Laura, we have free fertility coaches. So we sometimes call them navigators, and we felt like people weren't understanding what a navigator is, but we have free fertility coaches with an average of 30 years of fertility experience. So reach out, either navigators, we're going to change the email, even navigators@medanswers.com, or through this channel, Fertility Answers. You can also download and register the Fertility Answers app, and we'll make sure that we connect you with a fertility coach. But let's start there. Sometimes that's the best place to start.
Oh,
and if
huge. I think that's huge. Just to have somebody, like, you have a good doctor, you have a good nurse, but sometimes it's just good to just have a buddy, somebody to run this by. And if you know anybody, if you have any friends or family that have been through IVF before, sometimes that's super helpful too. Like just to know, like, you're
That's right.
Alone.
Exactly. Oh, I'm so glad now that you love the app. We're so happy to hear that. We did a study recently that showed a vast volume of people that come back repeatedly over the course of a whole year. So we know this is such a long journey. I'm looking at having my second child, and it's been a 13-year journey. And that's, kind of wild to think about, how much support and guidance and care we need. And that's the hardest part, is like, let's just start with the emotional support. I met somebody in the spring, and I found out just a few weeks ago that she had, even though she works in our field, I didn't know at the time that she was gearing up, she was becoming a patient. So I met her probably March timeframe, April timeframe, and just around April, she started her own journey. And a few weeks ago, she let me know that she was just about to do her frozen embryo transfer, and we were just connecting with each other over text about progesterone and how unfun the injections are. And, I got to be there, bear witness to, being the first person that found out she had a positive from her frozen embryo transfer. And just for us to be able, and then I got to send her my favorite children's book to say congratulations, so you actually just end up connecting with some amazing people that you just don't even know. I haven't even met this woman in person yet because it's COVID. It's been really exciting.
Big on Instagram, you guys are already on Instagram because you're here. There's such a big infertility community. Like, I love it. Like, this is Dr. Eduardo Haraton's
a cub come true, an IVF story. So cute.
Being an IVF
so cute
IVF baby. So that he wrote, he's a reproductive endocrinologist with another reproductive endocrinologist for kids. So we're so glad you're here. Being on the Instagram community, I think you do have to be careful about crazy information, but that's what's so nice about MedAnswers is
everything is vetted. Everything is vetted. Every piece of communication.
Certified. They're actually real board certified doctors, and not just me, but
370 or 80 of them. Exactly.
You have so many great board certified reproductive endocrinology specialists that are directly on the app. And, I think that's a really rare and wonderful resource. So hopefully you'll take advantage of it.
Yeah, you're welcome, Laura. You're welcome, Nakaya. I'm so glad that you all are finding good support and help.
Thanks so much for coming, you guys. That's
I think we have one last question, Alice, too, before we go.
You're going to be posting some questions for me because I'm doing a presentation at American Society for Reproductive Medicine about genetic counseling and how overwhelming all the genetic information is. And we really want to hear from all of you guys about how you feel about genetics and information and what
genetics and infertility
you're looking for.
What you don't know, what you do know. So you probably saw us post on our Instagram stories about this. We're soliciting questions. So just post to that story on genetics and infertility, and Dr. Chen and Invite will go ahead and answer your questions directly, and it'll help shape their presentation. So you have a real chance to start shaping the future of reproductive medicine, even for other providers, which is super exciting. So we're going to take one last question. I think this one's a really good one. Ingrid KK is asking, she knows she has PCOS. What is a good age to start trying, given the length of time that it could take for someone with PCOS to start, to actually be successful?
Okay, so I feel like a PCOS patient should actually see a reproductive endocrinologist before
Agreed.
they're even ready to start trying. So maybe like, in your early 20s, honestly, sometimes even earlier, if you're really struggling with the hair growth and the acne and things like that. We have talked about PCOS before, that sometimes even that early, it's a little difficult to diagnose, but I feel like that's a good time to start getting advice and information. And then I would say, having a child involves so much more than just biology. So we like people to, we'd love people to get pregnant 25, be in their 20s, but financially and logistically and just psychologically and relationship wise, it may not make sense until later. I think if you're in your early 30s and a baby is not happening soon, then we're talking about egg freezing. So we want you to be empowered with information starting very early, teens, early 20s. If you're not ready to have a baby by the time you're 30, we want you to start thinking about freezing your eggs before you turn 35. And
absolutely,
once you turn 35, your fertility does start to dramatically decrease and the risks start to increase. It's not the end of the road. So I don't want, people to be hopeless about that. But if we're thinking about idealizing and being super proactive, those are some time points to think about.
And a fertility specialist in particular can help those who have PCOS understand genetic and non-genetic factors and what those lifestyle changes are, even those nutritional changes. So I think that's really important.
There's so much that can be done because, you're at lifetime risk for, diabetes and high blood pressure, cardiovascular.
Yeah, this is not a reproductive aged issue. This is a lifetime
all those
condition.
Things can be prevented. And the earlier you start with a healthy lifestyle and the interventions, the better your chances are of preventing these things. So we're really excited about.
Yeah. And remember, we did, with the data that we had on our users and the support of our medical advisory board, and the work of Illumina, the largest genetic testing company, we do have a genetic kit that helps give you insights, actionable insights. So we do look at all the PCOS markers so that you can just understand what is genetic versus what is lifestyle. We can't control everything. We are born with the genetics that we have, but they're not a life sentence. So you can find that, I believe, on fertilitygenetics.io. It's very empowering.
Right? Getting that insight is then, on the one hand, you're like, oh my gosh, I have this risk factor. On the other hand, knowing about it, now you can do something.
Yeah, Emily brings up a really good point, and I know we're running out of time, but I want to address this point in particular. Emily says it's so hard to lose weight with PCOS and so easy to gain. Don't we know that? I mean, we get it. And there are people, if you do this genetic kit, that's one of the things that we look at is those who have genetic weight that coincides with PCOS. Not everyone does. And there are other things that kind of coincide too to make it harder or easier to gain or lose weight. We do have a partner that has been vetted by our scientific advisory board. They're called Life as Imagined. They have another program called Ideal Protein. So you can look at Ideal Protein or Life as Imagined. Life as Imagined is their reproductive enhancing nutritional program to help people reverse insulin resistance and help them get on that path. So they have actual research that they did with people who have PCOS. We met them at ACOG 2 years ago, and we were so excited about them because we just feel like this is a huge gap in the market where you're supposed to read a book and know exactly what to do. This program comes with a nutrition coach. It comes with foods. It comes with teaching you how to eat for you in particular. I tested the program. Yes, I was very happy to lose about 15 pounds. But more so what I was happy about is to, find a method of eating for me at like this perimenopausal, stage of life, even when I want to gear up for another frozen embryo transfer, where I felt like my blood sugar was super steady during the day. So that was a big win for me and a big improvement. So we did do, if you check out our YouTube channel, we did do an episode with Life as Imagined, so you can understand how their program is different than some other, but I really empathize with you. We hear it over and over again, how hard it is to lose weight. And just know you're not alone, Emily. The average BMI of people who do IVF is 31, right? And BMI is, it's an imperfect marker for kind of health and wellness. So I don't want you to put too much weight into it. But even on our app, the average BMI, tends to get up to 33 and even over 40. So wherever you're at on the spectrum, I just want you to know that you're not alone. 100%, you're not alone. Those 2 pages again, I believe, I'm actually embarrassed because I think it's fertilitygenetics.io is the genetic kit. And then it is idealprotein.com and lifeasimagined.com. So ideal protein,
this is
life
gonna
as
end up on
imagined.
YouTube at some point, right? And then it's going to be on IGTV. And maybe we could put the show notes in there or something like that.
Yeah, exactly. I will
and
definitely.
Just 2 words to add to that is think about intermittent fasting. So that's another concept that I think can be very helpful for PCOS.
Emily talked to us about that. She was rejected based alone on her BMI. We don't love hearing that. So can you DM and let's have a conversation? Happy to get on text and phone with you. And so I can understand a little bit more about where you're located, who your doctor was, because we'll be able to kind of gut check if you were treated the right way, based on that fact alone. So some people do have an upper BMI limit that they won't stim. And we've done some other episodes on that topic itself that you can search on our YouTube channel. But I think it's always worth bringing up again. And we should probably focus a whole show on that. The other one that we will focus on, and somebody brought up, is the myoinositols or the inositols. The inositol. We actually have been talking about that, Serena and I, that we know we need to have an inositol conversation with you all. So just stand by for that. We're preparing it. Give us a couple more weeks before we bring that together.
Fascinating. Yeah.
Yeah, it's super fascinating. So we'll get back to that too. So we love being with you all. If we didn't get to every single person's question, we're sorry. I know somebody asked about endometriosis and what it is. We have a whole library of endometriosis content.
Episode, girl.
It is. It's big. Yeah. So please come back and DM us. We can get you those YouTube links as well. There's always so much. It's never ending, but we're here for you all every single Monday.
Thank you so much for coming. I'm so glad everybody joined us. Thank you.
Me too. And tomorrow at 4:00 Pacific time, I'll be with Dr. Raquel. I'm not even sure what the topic is, but we always have a blast talking as well. So thanks. Something. I know. I didn't even know last Tuesday was Tuesday. So at least tomorrow, I'm like telling myself all day today on Monday, tomorrow's Tuesday. Don't forget it's going to be Tuesday. We'll see you guys on the app and we'll see you on our social. So thanks everybody. Be well.
Have a great day, guys. Stay safe.